The 10BedICU project was born in the peak of COVID pandemic wave 2, when the positivity rate spiked across the country. When the big cities had a shortage of ICU beds, ventilators, and oxygen, there was an even bigger problem in smaller towns and rural areas. Many of them had no critical care facilities at all. Conceived by Shrikant Nadamuni, founder CTO of Aadhaar and managing trustee of eGovernments Foundation, the 10-bed ICU project began as an attempt to address this gap.
Initially, we just thought about creating a 10-bed ICU in a government hospital where the poor people usually come and create this ICU with all the best equipment. We realized there was about 26 pieces of equipment we needed. So we started importing ventilators from Switzerland because they were AI ventilators which could auto-wean patients even without specialist interventions. ABG auto analyzers and X-ray machines, ECG machines, so on and so forth. Of course, the beds and so on. Soon we figured out, even after creating these ICUs, they don't have specialists. And so we came up with the idea of an online system called TeleICU, where specialists in medical colleges would help smaller hospitals through this online system, through the cloud system that we built, so TeleICU. So that was the second sort of pillar of the program. The third was, of course, a solid technology platform for patient records, for managing the doctors, the facilities, all of it, the pandemic management as well as the TeleICU management and so on, a care platform. And today, our care platform, the software platform, is considered by the United Nations as the 50th public good in the world. Fourth was training. We had to train our doctors and nurses on basic critical care as well as advanced training, both on the clinical side as well as on the technology side. How do you communicate with a doctor or a patient who's 100, 200 kilometers away? And how do you manage this TeleICU caregiving?
The public-private partnership between Karnataka Health Department and the 10BedICU NGOs, namely eGovernments Foundation and Karuna Trust, launched the 10-bed ICU project in each of the 41 taluka hospitals across the state, covering every district, with the aim to improve access to critical health care.
So the 10-bedded ICU for the state government hospitals was a wonderful scheme, which is good both for the COVID-19 management and also in general. 10-bedded ICUs are very essential for all emergencies in the rural areas.
The project is made possible with the generous donations from Crypto Relief Fund, Give India, HDFC Bank Parivartan, and Shrikant Nadamuni. An MOU is signed between the government and the NGOs, and a project management unit or a PMU is created with senior officials of the Karnataka Health Department and the 10BedICU members.
Once we decide to deploy 10BedICU project in any state, so we select the sites. Then there is a rigorous 52-step process to deploy the project. Though we have a standard template, each site is different. Each site is unique in itself. Few may be very far from the urban place. Reaching the hospital itself was a challenge.
Once the sites are ready, the 10BedICU donates an entire package of critical care medical equipments. The high quality equipment is not only gifted to the hospitals, but the complete installation and training along with 3 years of warranty is covered under the project.
10-bed ICU, when the idea started, it was like we are going to give a 10-bed ICU unit to each taluk hospital. And we did. We deployed, we have implemented the project now. An ICU setup means it requires a multi-speciality care, be it neurology, cardiology or radiology, any department for that matter. And remote hospitals cannot have multiple specialties with them. That is when the idea of TeleICU came in.
The first implementation of the TeleICU hub in Karnataka is at Mysore Medical College along with KR Hospital, which will support 5 taluka hospitals at Virajpet, HD Kote, Nanjangud, Santemarahalli, and Malavalli.
Tele-ICU is the facility where the patient from the remote places or patient in the Taluk center will be monitored through the technology in the hub region like MMCRI Mysore, where we will assess the patient condition here only and we will deliver the proper care from the Mysore Medical College through the hub and spoke model. So hub and spoke model means spoke is a Taluk centers usually, hub is a MMCRI where all the data from all the spoke hospital will be monitored in the hub center. So what happens when patient admit in the spoke hospital, all the parameters including all the important parameters, his records will be recorded in a digital software.
Care software is at the very core of the 10BedICU project.
CARE not only improves clinical outcomes, but also empowers the state and district level administrators with insightful dashboards for comprehensive healthcare administration and delivery. Training on various aspects of critical care and tele-ICU are imparted, including clinical training and software training. Theory classes, both online and offline, are combined with hands-on sessions to ensure holistic learning.
10-bedded ICU is helping many people and it is saving many people's life.
ಐ ಥಿಂಕ್ ಇದು ಈ ಗೌರ್ಮೆಂಟ್ ಫೌಂಡೇಶನಿಂದ ಇದು ತುಂಬ ಒಳ್ಳೆ ಪ್ರಾಜೆಕ್ಟ್ ಆಗಿದೆ. ಇದಕ್ಕೆ ಐ ಥಿಂಕ್ ನಾವು ಎಲ್ಲರೂ ಕೈ ಜೋಡಿಸ್ಬೇಕು. ಸೊ ನಮ್ಮಲ್ಲಿ ಯಾರ್ಯಾರು ಸ್ಪೆಷಲಿಸ್ಟ್ಗಳಿದ್ದಾರಾ, ಡಾಕ್ಟರ್ಸ್ ಆಗಿರ್ಬೋದು, ನರ್ಸ್ಗಳಾಗಿರ್ಬೋದು, ಪ್ಯಾರಾಮೆಡಿಕ್ಸ್ ಆಗಿರ್ಬೋದು, ಅವರೆಲ್ಲ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಟ್ರೈನ್ ಆಗಿದ್ದಾರೆ. ಸೊ ಆ ಟ್ರೈನೀಸ್ನ ನಾವೇನು ಮಾಡ್ತೀವಿ ಅಂದರೆ ಅಲ್ಲಿಯವ್ರಿಗೆ ಕೈ ಜೋಡಿಸ್ಬಿಟ್ಟು ನಾವು ಇದನ್ನೊಂದು ಉತ್ತಮ ರೀತಿಯ ಪ್ರಾಜೆಕ್ಟ್ ಆಗಿ ಹೊರಮುಗಿಸೋಕ್ಕೆ ನಾವೆಲ್ಲರೂ ಒಂದೇ ಸ್ಥಳದಲ್ಲಿ ಅವ್ರನ್ನ ಕನೆಕ್ಟ್ ಆಗಿಬಿಟ್ಟು ಕೈ ಜೋಡಿಸ್ತೀವಿ ಅಂತ ಹೇಳ್ತೀವಿ.
The project is an innovative approach to solve some of the most difficult problems in public healthcare through collaboration between Department of Health, medical education, the social sector, and the industry.
We can improve the ICU critical care infrastructure by creating 10-bed ICUs across the country. We need tele-ICU technology in order to deliver ICU critical care in remote areas, in small hospitals. We also need to standardize ICU protocols and training, both clinical training as well as systems training. Finally, we have already deployed over 200 10-bed ICUs across 8 states, covering 24% of the country's districts. Our goal is to deliver a 10-bed ICU in every district of the country. Thank you.